Number 15. Your body can grow bark. Warts are not uncommon, but they don't often make your limbs grow bark like a tree. But they can. In Dede Kosawa's case, it happened from a simple cut as a teenager. After this, warts popped up and spread. Over the course of 20 years, more and more appeared on his feet and hands and began sprouting strange knotted roots. Some physicians in Indonesia diagnosed Kosawa with human papillomavirus, HPV, combined with a genetic immune defect. While the HPV-2 virus is what produces common warts and is what Kosawa is infected with, his genetic disposition meant he was deficient in white blood cells, resulting in a weak immune system which couldn't combat the HPV. The virus took over from there, infecting his skin cells and making them overproduce keratin at a catastrophic rate. Keratin is a protein, which in Kosawa's case is said to have made his hands sprout their extreme bark-like warts and extend around 3 feet out. His arms were weighed down with 12 pounds of these growths, also known as cutaneous horns. As he was only 100 pounds, the weight of the defect was more than overbearing. Though local doctors followed the basic protocol for warts by removing them, they grew back at an even faster rate after the operation. He couldn't make a fist or pick things up, which made the very act of eating and working a struggle. Instead, he started performing at carnivals as the Tree Man. American dermatologist Dr. Anthony Gaspari, who became interested in the case and flew to Indonesia to study it, said of Kosawa, his life was taken away from him. He was severely disfigured and was sent into a rural, isolated village where he was sheltered from his peers. With good reason. He was a sad man. He wanted to be cured and he wanted hope. Not only did the growths isolate and exhaust him, they would eventually become infected and begin serving as home to insects. They even began to grow around his eyes and nose. An Indonesian journal quoted Kosawa as saying, "I am afraid that it will cover all my face. I won't be able to see, I won't be able to eat." Indonesian doctors have since sawn off 12 pounds of cutaneous horns from his feet and hands, replacing skin on his forearm with grafts from his buttocks and back. Kosawa has been making progress following the surgeries and gained some weight, although new warts have sprouted up since. Chemotherapy is being used to combat the virus. While Kosawa's condition is rare, it is not unique. The same condition has been found in patients in Romania and China. Though it's not likely to ever affect you, it's truly scary that a human body can do this. It's a proven fact that generosity makes you a happier person. So if you're generous enough to like this video, then thank you, because it really helps us out. Number 14. Your body hosts mites that are invisible to the naked eye. You probably feel clean after a shower every day. You probably don't feel irritated when you sleep at night. You probably don't notice anything crawling all over the faces of your friends, family, and every single person you meet. But guess what? There are tiny microscopic mites crawling all over nearly every human body all the time. With over 48,000 mite species, it's no surprise that some of these mites live on us. In fact, 2 types live on our faces. They are long, cone-like, and have short legs on one side. They burrow down into our hair follicles, and that includes your eyebrows and lashes. Yup, they literally live right before our eyes, and still, we can't even see them. Why have they decided to make human faces their home? Mainly because the oils our skin secretes are a tasty delicacy to them. They feed off these oils and sleep, crawl, and mate all over our faces. Scary and pretty disgusting, huh? And when we say they're on everyone, we mean everyone. Scientists at North Carolina State University took a sample of Americans and discovered that each one had face mites. They swapped pores, checked out the results under a microscope, and lo and behold, creepy, wormy mites. This is not new news. These mites were discovered all the way back in 1841 when Gustav Simon, a German dermatologist, described them as worm-like with legs and heads. As he examined the wormy creature more closely beneath the microscope, he found it moved. The mites were called demodex, demo being Greek for lard and dex for worm, being it was deemed a worm that wormed its way into fat. The mites have since been found across countries and continents. They do not discriminate when it comes to who they bore into. William Nutting, a mite specialist, wrote in 1976, "One can conclude that wherever mankind is found, hair follicle mites will be found and that the transfer mechanism is 100% effective." Want to hear something scarier? When researching the mites, their DNA is collected through their excrement, of which a lifetime's worth is released only when they die. Demodex DNA is found in most adults and on 70% of 18-year-olds sampled by researchers. They seem to appear more and more with age, and the two species of mites, though not all that different in appearance, do live and travel differently. One burrows deep into our pores and, like a hermit, never leaves, while the other does not burrow so deeply and therefore can travel from one person to another. So before you judge someone on their appearance, remember that beauty is only skin deep. Look any deeper, and you'll find the skin is crawling with these disgusting insects. Number 13. Your body glows. Whenever you feel lost, know that your body will light your way. Literally. That's right, the human body emits small amounts of light that perhaps aliens can see, but the human eye most certainly cannot. Why can't we see it? Because our bioluminescence is 1,000 times weaker than what our sight can detect. So being that we can't see it, how was this creepy discovery made? Well, scientists have long suspected that our bodies emit light, but that the light is too weak to be seen by the human eye. But they recently found that it's not too weak for super-sensitive cameras to catch. These cameras capture the faint bioluminescence of the human body. While science has known for decades that all biological beings produce some light, Japanese scientists were the first to capture images of human light through their high-tech cameras. The scientists detailed their research explaining how, over several days, the upper half of volunteers' bodies were photographed using ultra-sensitive cameras. They found that the light cycle followed a 24-hour pattern, with a low amount of light emitted at night and a high amount in the afternoon, while the neck, forehead, and cheeks emit the greatest amount of light. One odd find from the research was that the thermal levels of body parts did not correlate with the levels of light in these areas. Our innate glow also seems not to play any evolutionary purpose, like it does in deep-sea fish or fireflies, which glow to illuminate the darkness and/or attract mates. Not to get too technical, but the glow is likely due to metabolic reactions, which involve free radicals responding to proteins and free-floating lipids, resulting in excited molecules. These molecules might then interact with fluorophores, producing photons, thus the bioluminescence. Too science-y? To put it in layman's terms, chemical reactions make our bodies glow. It may not seem scary to you, until an alien invasion that you can't run or hide from. Your glow will give you away, so get ready for a good probing. Number 12. Your body can grow a tumor with hair and teeth. Your body is a ticking time bomb, but some bodies kaboom louder than others. This list will show you when and why you should run as fast as you can away from your own body. While this first entry only applies to women, the human body doesn't get much creepier than a tumor with hair and teeth. That sounds super grotesque. Let's face our fears and look more closely. Medically termed an ovarian teratoma, this ovarian cyst can grow various tissue, like a human or other much scarier creature. Along with hair and teeth, it can also grow thyroid, neural tissue, and bones. Yikes. However, despite its frightening nature, the tumor is most often benign, with only 2% recorded as being malignant, aka cancerous. Still, depending on its size, the monster can twist the ovary and block blood flow, which can cause pain and other more severe problems. When this happens, an emergency surgery is called for. Why is this particular tumor so weird? Well, because it is formed from a totipotential germ cell. Totipotential cells can produce various other cells that develop mature tissue and the aforementioned structures like hair and teeth. The germ cell develops within the ovary, producing a dermoid cyst that can grow up to 45 centimeters in diameter. That's 17 inches, folks. While women of all ages are susceptible to this type of tumor, development most often occurs during childbearing years, around the age of 30. About 85% of women who contract ovarian teratomas only have them in one ovary, while the remaining 15% have these terrors in both. Due to the problems that can occur with a dermoid cyst, and also likely due to its inherently creepy nature, most choose to remove the cyst through open surgery or surgery with a scope. I mean, look at this thing. No one would want this monster baby living in her, even if it isn't cancerous. Number 11. Your body can produce different tear compositions. This theory will have you crying all the way to the microscope. Perhaps not so scary as it is scary awesome. An avant-garde photographer, Rosalind Fisher, has found that all human tears are unique. Fisher used extremely strong scanning electron microscopes by which she magnified dried human tears to examine their composition. The project, Topography of Tears, was begun during a tumultuous time in Fisher's life in which she experienced loss and change, which gave her a surplus of raw material. After similar projects in which she examined bees and her own hip bone up close, she explained that everything we see in our lives is just the tip of the iceberg, visually. So I had this moment where I suddenly thought, I wonder what a tear looks like up close. She then wondered if emotion would change this aerial-like landscape view of her tears. Over several years, Fisher stole tears from others and herself. With over 100 tears gathered, her tear collection even includes that of a newborn baby. As she put together this project, Fisher found that tears are scientifically separated into 3 types: basal tears, reflex tears, and psychic tears. Basal tears naturally lubricate the cornea. Reflex tears occur due to an irritant like onions or dust. And psychic tears are the result of positive or negative emotion. Tears are also complex in composition, with enzymes, antibodies, and oils combined in salt water. But Fisher discovered that each category of tears contains specific molecules. For example, psychic tears often include leucine and syphilis, a neurotransmitter that serves as an innate painkiller to be released when the body is stressed. Moreover, Fisher's project provoked incredibly different compositions within the same category of tears with the same chemical makeup, due to the environment and evaporation rate in which it was produced, as well as the viscosity and the chemistry. Although this scary intricacy of a teardrop is profound in and of itself, Fisher's description of her project is even more so. Tears are the medium of our most primal language, in moments as unrelenting as death, as basic as hunger, and as complex as a rite of passage, she said. It's as though each one of our tears carries a microcosm of the collective human experience, like one drop of an ocean. It's scary how little we know and can see about our own bodies. Number 10. Your body parts can explode. We said your body is a ticking time bomb. Well, imagine if it went the way of an eyeball explosion. That's where contracting Fuchs dystrophy will land you. Now, before you get ahead of yourself, don't picture your eyeballs popping and blasting out of your head. Fuchs dystrophy is a little subtler than that. An Australian ophthalmologist, Ernst Fuchs, first described the condition in 1910. He found 13 cases of corneal clouding and loss of sensation in the cornea, which led to a slow progression of reduced visual acuity, especially when the patient first wakes up in the morning. The thickening of a membrane and the pileup of focal outgrowths results in the corneal edema and loss of sight. As the membrane in the cornea becomes incredibly thick with abnormal collagen, swelling progresses and, as the end stage of the condition approaches, blurred vision leads to severe impairment and finally, focal blisters. These blisters can burst painfully, making it even more apparent that your eyes are exploding. While it may not be the sudden and unexplainable eyeball explosion that you imagine, it is disgusting and scary. But if you're young yet, don't worry your pretty little head about it. The cloudy condition is more prevalent in those in their 50s or 60s, and is a degenerative disease, so you likely have a few more years until your eyeballs explode. Number 9. Your body hosts more bacterial cells than human cells. Not only do our bodies host mites, they host dozens of bacterial cells. Bacteria thrives on our skin, teeth, tongue, and intestines, and viral organisms can lay dormant in our nerves for years. More often than not, these 90 trillion-ish microbes are good roommates. They live on our bodies without causing significant issues, doing the dishes and taking out the trash just like any good roommate. But there are bad roommates who want to attack your body and wreak havoc in your skin and innards. Bad roommates like lice, bedbugs, or herpes simplex. Let's not be prejudiced here. As I said before, not all bacteria is bad, and the good bacteria maintains the balance within our bodies and even helps prevent the bad guys from taking hold. But if and when the bad guys do overtake the good, antibiotics are often used to help destroy the bad bacteria. The problem is, antibiotics often can't differentiate between the bad and the good, so they can also often destroy the good, which may lead to other health issues. It's scary that our bodies are basically one bad bacteria away from contracting a serious health problem. Now let's see which of these roommates we should kick out onto the curb. For women, vaginal flora helps attack pathogens like Candida albicans. This bacteria is a good guy. More good guys, firmicutes and bacteroids, which reside in the gut and break down carbohydrates while producing vitamins and nutrients and deterring harmful bacteria. Staphylococcus also helps metabolize sweat and retain the health of your skin. Trichophyton and epidermophyton are microbial parasites that are contagious and lead to athlete's foot, jock itch, and ringworm. Total bad guys. More bad guys? Dental streptococcus, also known as plaque. Those who don't often brush develop this film of bacteria on their teeth, which can, of course, cause dental issues, not to mention bad breath. HPV, which led to the bark-like skin in entry 12, and more commonly leads to plantar and flatwarts, is another bad roommate. HPV can also be sexually transmitted, and some strains may even lead to cancer. So now that we know not all bacteria is bad, we can perhaps come to terms with our roommates, but keep an eye on the parasites and viruses. Number 8. Your face has a Bermuda Triangle. You've heard of the Bermuda Triangle, but have you heard of the one on your face? Known as the Danger Triangle, the region of the face that ranges from your mouth's corners to the bridge of your nose is home to a special blood supply that can infect your brain. How does this happen? Well, if you get an infection in your nasal region, it can spread to the oh-so-important cranium, resulting in brain abscess, meningitis, or cavernous sinus thrombosis. You don't want to deal with any of these serious issues. The Danger Triangle is so dangerous because there is communication between the cavernous sinus and the facial vein, allowing infection to reach the brain. The direction of blood flow also enables infection to spread in the face. Talk about a ticking time bomb. This Danger Triangle was discovered around 1852 and was later verified in a 1937 study. More than half of the cases of cavernous sinus thrombosis were caused by infection that had began in the Danger Triangle. Antibiotics are now used to treat the disorder, but the risk of fatality is still high. Why is cavernous sinus thrombosis so deadly? Because infection in the cavernous sinus results in the blood in the sinus clotting, thereby impacting those structures passing through it or adjacent to it. This causes various nerves to start failing, which prompts muscle and gland dysfunction. The pituitary gland and the optic chiasm can also become suppressed. Not good. While this facial danger triangle may not be as mysterious and unexplainable as the Bermuda Triangle, it is just as deadly, if not more so. If an infection starts in your danger zone, take it seriously and seek medical treatment. Number 7. Your head can explode. Not only can your eyes explode, your entire head can too. Okay, again, this is not a literal explosion. Don't get carried away imagining the unfortunate head crushing of Prince Oberyn by the mountain on Game of Thrones. Exploding head syndrome is nothing like that. This disorder is psychological, involving perceived bangs, gunshots, or bombs exploding. Any loud noises, really, when those susceptible to this disorder are falling asleep or waking. The disorder isn't painful, but just imagine waking up to a shattering noise in your head. You can probably picture yourself startling and maybe wetting your bed a little when surprised with such a violent noise. Though the head doesn't actually explode, the brain is confused and distressed enough to believe it has, so those who suffer from exploding head syndrome may experience palpitations or tachycardia from their fear and distress. Not much is known about the cause of the syndrome, although some scientists suggest it may be connected to minor temporal lobe seizures or abrupt shifts or structures in the middle ear. Still, others suggest that brainstem neuronal dysfunction, stress and anxiety, or dysfunction in calcium signaling may be the cause. This is why, while there is no cure, some treatments include triglycolic antidepressants or calcium channel blockers. Relaxation techniques and counseling are also recommended. It's estimated that exploding head syndrome may affect up to 10% of the global population. It impacts women more often than men, usually around the age of 50. So if you find yourself waking suddenly to bombs, crashing cymbals, or other loud and startling noises, you may be suffering from exploding head syndrome. Don't worry, your head is still intact. Number 6. Your belly button is a trapdoor to another world. You may consider your belly button as a place where your umbilical cord feeding tube once existed, or as simply a fashion statement in which your 16-year-old daughter bears her new piercing. But consider this, it may be its own little world. For a long time, the belly button had gone unexplored, but recently a group of researchers led by Dr. Robert Dunn delved into the human belly button, swabbing and culturing 60 participants. They took their bacteria samples and examined them under a microscope. What they found is astonishing. Over 2,000 different bacterial species were discovered to live in these belly buttons, and some were quite unique. Dr. Dunn wrote about the expedition relating belly buttons to rainforest, due to their diverse range of rare species. As we looked at belly buttons, we saw a terrible, yawning richness of life. The average belly button hosted 50 or so species, and across belly buttons we found thousands of species. And, as we sampled more belly buttons, we continued to find more species. The vast majority of these species are rare. Although 70% of them included the most common bacterial species, diverse bacteria were found across the spectrum of belly buttons sampled. Dr. Dunn and his crew didn't have an answer as to why each person's belly button is so individually distinct when it comes to the biodiversity that resides there. No theories as of yet can explain the unique diversity of species in this small little button, but scientists are learning more about the belly button every day. This simple fashion statement is fairly unexplored territory, just waiting to be discovered. Number 5. Your heart can literally break. When someone says they're heartbroken, you know they've experienced love loss of some kind. But what you might not expect is that their heart can literally break as a result. Stressful situations like the death of a loved one, surgery, or serious illness or trauma can cause broken heart syndrome. This temporary condition may feel like a heart attack, with sudden chest pain resulting from a dysfunction to the heart's normal pumping. This only occurs in one region of the heart, allowing the rest of the heart to function as usual. Though it may not result in fatality, it can amplify your stress as you realize your heart isn't functioning properly. Also known as stress cardiomyopathy, the cause of this temporary dysfunction may be due to a sudden rush of stress hormones like adrenaline. In addition to chest pain, many experience shortness of breath. Although scary, these symptoms are treatable, and the syndrome is usually cured within several days or weeks. Those at greatest risk for broken heart syndrome include women older than 50 and those with a history of neurological conditions like epilepsy or head injury, or psychiatric disorders such as anxiety or depression. If you suffer from a broken heart, beware of broken heart syndrome. The stress of loss or trauma may, in fact, temporarily break your heart. Number 4. Your flesh can be eaten by bacteria. Remember all that bacteria living on your body that we mentioned before? Well, although much of it is good, some of it isn't friendly. In fact, it may want to eat you alive. Necrotizing fasciitis is a flesh-eating disease caused by a bacterial infection. The body's soft tissue is suddenly attacked and the disease quickly spreads, resulting in red and purple skin, fever, vomiting, and acute pain. The body's limbs and perineum are most often affected, and, as it progresses, it appears more and more ghastly. 4 types of classification are used, depending on the type of infecting organism involved, but the most common type of bacteria is methicillin-resistant Staphylococcus aureus, MRSA, which infects a third of the cases. The scariest part is that a mere cut or burn can allow the infection to enter the body. When it does enter, the individual will feel intense pain and may experience fever, a rapid heart rate, and inflammation. As the disease progresses, swelling of tissues occurs within hours, and the skin begins to discolor and produce blisters. Dishwater-colored fluid may be discharged from the blisters, while vomiting and diarrhea are symptomatic. Pre-existing conditions that can exacerbate the issue include obesity, diabetes, cancer, alcoholism, drug use, or peripheral vascular disease. Although necrotizing fasciitis looks frightening and the risk of fatality is between 25 and 35%, methods of prevention and treatment do exist. Take care of your wounds and wash your hands to prevent an infection. Intravenous antibiotics and surgery to cut out the infected tissue is the most common treatment for the flesh-eating disease. Without this treatment, the infection will progress quickly and, more often than not, lead to death. Don't become a bubble boy just yet. Necrotizing fasciitis is rare, affecting only 0.4 to 1% in every 100,000 people annually. Number 3. Your brain can shrink and grow. Most new moms joke about having baby brain during and after pregnancy. Baby brain often manifests itself in forgetfulness or a lack of concentration. Although some might consider it simply psychological, an actual measurable alteration in brain size during and after pregnancy may have something to do with it. A study has shown that the maternal brain decreases significantly in late pregnancy and then regrows to its normal size 6 months after delivery. The change was measured during and after healthy pregnancies and compared with those of preeclampsia cases, which are pregnancies complicated by high blood pressure and organ issues. The brain dimensions of 9 healthy patients as well as 5 women with preeclampsia were measured through MR volume images before and after delivery. Brain and ventricular volumes were calculated using a computer program. Both groups showed a reduction in brain size during pregnancy, which was maximum at full term. This reduction reversed after about 6 months following delivery. While the biological significance and mechanism by which the brain decreases in size during pregnancy is unknown at this time, perhaps the fog of baby brain is just a result of this size reduction. Just a hypothesis, but whatever the case, the change in size of brain matter is frightening. Number 2. Your body can shut down in your sleep. Speaking of babies, you've heard of SIDS, sudden infant death syndrome, which is the unexplained death of infants in their sleep. But have you heard of SADS? Sudden arrhythmic death syndrome, SADS, or sudden adult death syndrome is similar to SIDS in that the death is unexpected, unexplained, and occurs during sleep. SADS is extremely rare, but most often occurs in those who leave their culture and immigrate to another country. The syndrome was first discovered in 1977 when a group of Hmong refugees in the US passed away unexplainably in their sleep. A mass group of Thai immigrants in Singapore again died in their sleep between the years of 1982 and 1990, without explanation. The individuals were otherwise healthy. Most of the SADS cases involve Southeast Asian immigrants, and most are young men. While this phenomenon has been researched, the case has yet to be determined. Some scientists believe that the electrical signals that create a person's pulse suddenly fail, which ceases blood flow. Laotian Hmong men, in particular, seem to be particularly susceptible to SADS. A study in the 1980s of Laotians in the Ban Vinai region of Laos who had passed away from SADS included interviews of the victims' relatives about any extenuating circumstances that may have influenced the sudden death. Health history, sleep disturbances, demographic background, and the circumstances of the death were also examined. It was found that many of these victims had been experiencing symptoms the week before their deaths, particularly chest pain. Though no cause of death was ever discovered, a number of the victims suffered from hypertrophic cardiomyopathy, resulting in a thickened heart muscle, which again has no known cause. The mystery of the syndrome has led to many strange superstitions in affected cultures. Filipinos, for example, believe that SADS is caused by eating a large amount of carbs before going to sleep. Whatever the true cause may be, you may think twice before shutting your eyes and passing out in another country. Number 1. Your body is shrinking. Have you ever wondered why your great Aunt Myrtle is so teeny tiny? You've probably never questioned it, believing she'd always been a miniature in adult form. Well, think again. If you're 30 or older, you're not going to like the following scary fact one bit. At age 30, you start to shrink. That's right, you won't always be this tall and magnificent. You will in fact shrink by around a half an inch each and every decade. That means if you're standing at a majestic 5 foot 8 inches now, by the time you reach 90 years old, you may be 5 foot 5. You won't shrink suddenly, so you may not even notice that half inch stolen from you every 10 years. But as the discs begin to flatten between the vertebra, the joint space narrows and muscle mass declines, making most people lose height and stature. This is also what causes the stooping and hunching of the back. The shrinkage should happen gradually and is completely natural. On the other hand, if shrinking occurs suddenly and dramatically, some serious health issues may be the cause. A study done by Dr. Marian Hanan in affiliation with Harvard Medical School discovered that men over 70 who shrunk by 2 inches in 2 years were 2 times more likely to fracture a hip than their peers. Hanan concluded that height loss in both elderly men and women appears to provide a simple indication of who's at risk for hip fracture. Height loss in men points to something particularly problematic because they lose bone at a slower rate and often have greater muscle mass, so when they lose height, it's a likely indication of severe health issues. A UK study supports this. It found that men who lost more than 1.5 inches in the span of 20 years had a higher risk of osteoporosis, as well as heart attack and death. Bone density tools, along with height loss, are now being used to determine whether a patient is at high risk of hip fracture. As scary as shrinking may sound, there may be a way to help prevent it. Don't smoke, stay active, and eat healthy. Really, it's the same way you prevent all health problems and take care of your body. Make sure you also take in enough calcium and vitamin D to strengthen your bones.